Febuxostat, also known as Uloric, is a medication used to lower uric acid levels in people with gout. It works by reducing the amount of uric acid made by the body. This can help to prevent gout, which is caused by high levels of uric acid in the blood. It is important to note that Febuxostat should only be used after treatment with a medication called allopurinol did not work, caused serious side effects, or is not recommended by your doctor. Additionally, Febuxostat should only be used if you have symptoms caused by a high blood uric acid level. The daily dosage and optimal timing of Febuxostat should be determined by your doctor, based on your individual needs and medical history. Be sure to follow your doctor's instructions carefully and ask any questions you may have about the use of Febuxostat. Before starting Uloric, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth as directed by your doctor, usually once daily. The dosage will depend on your medical condition and response to treatment. It's important to take Uloric regularly to get the most benefit from it. To help you remember, take it at the same time each day. When you first start taking Uloric, you may experience more gout attacks for several months as your body removes extra uric acid. It's important to note that Uloric is not a pain reliever. Your doctor may prescribe other medications to prevent or treat gout attacks during the first few months of taking Uloric. Make sure to continue taking your prescribed medicines for gout attacks as directed by your doctor. If your condition lasts or gets worse, be sure to inform your doctor. If you experience nausea while taking Uloric, it's important to let your doctor or pharmacist know. This medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential side effects. It's important to attend all scheduled medical and lab appointments, as your doctor will monitor your liver enzymes through blood tests. If you experience symptoms of liver disease, such as ongoing nausea, abdominal pain, dark urine, or yellowing of the skin or eyes, seek medical attention immediately. Additionally, if you notice pink or bloody urine, painful urination, or develop a rash, it's important to inform your doctor right away. In rare cases, Febuxostat can cause a severe allergic reaction. Seek medical help if you experience symptoms such as fever, swollen lymph nodes, rash, itching or swelling of the face, severe dizziness, or trouble breathing. Remember, this is not a complete list of possible side effects, so it's essential to contact your doctor or pharmacist if you notice any other unusual effects. As for the daily dosage and optimal timing of Uloric, it's important to follow your doctor's instructions carefully. Be sure to take the medication as prescribed and at the same time each day to maximize its effectiveness. Febuxostat, also known as Uloric, is used to treat gout caused by high levels of uric acid in the body. It works by reducing the production of uric acid in the body. It is important to take this medication as directed by your doctor. The typical starting dose of Uloric is 40 mg once daily. It can be taken with or without food. It is important to drink plenty of fluids while taking this medication to help prevent kidney stones. Be sure to follow your doctor's instructions carefully and discuss any concerns you may have about taking Uloric. Before starting Uloric, it's important to let your doctor know if you have any allergies, as this medication may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history, including any history of cancer, heart disease, stroke, liver or kidney disease, or if you have had an organ transplant. If you are planning to have surgery, make sure to inform your doctor about all the medications and products you are using. If you are pregnant, Uloric should only be used if clearly needed, so discuss the risks and benefits with your doctor. It's also important to consult your doctor before using Uloric if you are breastfeeding, as it's not known if the medication passes into breast milk. As always, it's important to follow your doctor's recommendations and advice regarding the use of Uloric. When taking Uloric, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Uloric include azathioprine and mercaptopurine. Be sure to discuss any potential interactions with your doctor to ensure the safe and effective use of Uloric. If someone has taken too much Uloric and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911 or contacting a poison control center. In the US, you can call 1-800-222-1222 for your local poison control center, and in Canada, you can call a provincial poison control center for assistance. It's crucial to act quickly in these situations to ensure proper medical attention is received. It is important to not share Uloric with others. Your doctor may need to conduct lab or medical tests, such as uric acid blood level or liver function tests, while you are taking this medication. Make sure to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose of Uloric, take it as soon as you remember. However, if it's almost time for your next dose, just skip the missed one. Take your next dose at the usual time. Do not take 2 doses at once to make up for the missed one. It is important to store Uloric at room temperature and away from light and moisture. Be sure to keep it out of the bathroom and away from children and pets. When you no longer need the medication, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. Remember not to flush the medication down the toilet or pour it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.